Let's listen to an expert doctor for hypertension in young population, along with coronary artery disease and higher heart rate can be sure of happy heart. To talk about that, we have with us Dr. Debayan Biswas, attached in Tamluk Medical College, Tamluk. Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
I am Dr. Debayan Biswas. I am the senior resident of Department of General Medicine. Now I am attached with the Tamil Government Medical College and Hospital. Actually, according to the JNC guideline, the hypertension is defined as different stages. Okay, now the hypertension 1 and hypertension stage 2. If the borderline is about the 140/80 is the borderline hypertension, and average or mean hypertension we should depict about the 120/80. If a person's systolic blood pressure is more than 140 and the diastolic blood pressure is more than 80, then we follow these patients to the hypertensive stages.
Doctor, can high blood pressure be completely cured?
I am Dr. Debayan Biswas. I am the senior resident of Department of General Medicine. Now I am attached with the Tamil Government Medical College and Hospital. It depends upon the person's surroundings and the person's day-to-day lifestyle. If the person or the patient has been hearing about the sedentary lifestyle, for example, if he or she is taking too much amount of fast fooding and excessively feeling of the stress, just like familial or his or her official. Okay. So if the person fall into this type of situations, then it is very much difficult to control the hypertension of that patient. Okay. So, but there are so many medicine has been developed to control their hypertension, but it's not curable. It's totally depend upon the person's peaceful mind.
Doctor, has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
I am Dr. Debayan Biswas. I am the senior resident of Department of General Medicine. Now I am attached with the Tamil Government Medical College and Hospital. It is very much prevalent among young people that the cardiovascular arrest or the cardiovascular accident. It is very much prevalent among the young people. And the hypertension is directly or indirectly related to this type of cardiovascular accident. Because the hypertension is a state where it has been developed by extreme amount of consumption of the oily and fast food, and these oils and the cholesterol has been deposited in the blood vessels, and due to the deposition of this cholesterol molecules along the blood vessels, so it make a resistance to prompt supply of the blood to the cardiac muscles. If our heart is deprived of the blood which is mixed with the oxygen, so my heart is suffering from the ischemic state, means oxygen-free interval. This makes an onset of the acute episode of the heart attack or the acute myocardial infarction in our doctor terms. So I think the hypertension is directly and indirectly related to the cardiovascular accidents.
Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
I am Dr. Debayan Biswas. I am the senior resident of Department of General Medicine. Now I am attached with the Tamil Government Medical College and Hospital. Actually, according to the JNC guideline, the hypertension is defined as different stages. Okay, now the hypertension 1 and hypertension stage 2. If the borderline is about the 140/80 is the borderline hypertension, and average or mean hypertension we should depict about the 120/80. If a person's systolic blood pressure is more than 140 and the diastolic blood pressure is more than 80, then we follow these patients to the hypertensive stages.
It's public awareness initiative by Landmark Pharmaceuticals.